What's going on, everyone? It's Alex here from Aleks Physio. So today we're going to be going over red flag symptoms if you have spinal pain, such as back, neck, or mid-back pain. Before we move forward, red flag diagnoses are generally conditions that require more urgent or emergent medical attention. And there's generally 5 categories, and we use the acronym F.I.T.I.N, F.I.T.I.N, or N.I.F.T.I, N.I.F.T.I. So the F stands for fractures, the I stands for infection, the T stands for tumor, the other I stands for inflammation, and then the N stands for neurological. So with fractures, we're looking for individuals who have a history of osteoporosis, corticosteroid use, and elderly patients. For I, inflammatory, we're looking at individuals who have chronic pain longer than 3 months, looking for pain at rest that improves with exercise. For some of the different inflammatory conditions for pain, for spinal pain, we're looking for blood work, so the presence of HLA-B27 for individuals who are later diagnosed with AS or ankylosing spondylitis. We're looking for other blood work, so ESR, CRP, C-reactive protein. It looks for levels of inflammation in the body. And then for N, we're looking for neurological. So worsening, numbness, tingling, radicular pain, pain going down our arms, one arm, both legs, cauda equina syndrome, so saddle anesthesia, so numbness, tingling around our genital area, or difficulty with having a bowel or bladder movement. Those are generally the 5 categories, and then each category will be assigned specific imaging interventions or follow-up just based on what we suspect may be going on based on some of the other factors and the other questions. The first one is history of cancer. History of cancer you'll be asked by a healthcare professional about, because even if the cancer has resolved and you have no issues or it was a while ago, there is a potential always with cancer for it to come back, or also some cancers can metastasize where they can affect your spine. So we're always asking for history of cancer. Number 2 is we're asking for fevers, chills, nausea, night sweats. Why do we ask this? This can indicate the signs of an infection in the spine. If there is an infection, it does affect or has a tendency to affect multiple systems. So if you have a fever, it's your body is trying to, that came at the same time of your back pain or around that time, there is a potential that those two are associated. So we're looking for that. Number 3 is unexpected weight loss or weight gain. If you have a tumor or other form of cancer, that can affect the metabolism in your body and can affect how the nutrients or the percentage of the nutrients that are being absorbed, which subsequently you could be eating the same amount of food but still be losing weight. And again, if this is coming on or around the time that you are having this back pain, it's important to look at this as a question for possible red flag finding. Number 4, we're looking at the past medical history. Specifically, we're looking for things such as history of IV drug use, history of corticosteroid use, history of osteoporosis, because these can indicate signs of possibly an infection or a fracture, just because osteoporosis makes bones more brittle, and IV drug use and corticosteroid use can also make them more susceptible to fracture, and IV drug use can make individuals more susceptible to an infection just because of some of the practices that may or may not have been involved in that process. So these are some of the questions of why we're asking them. Number 5 is atypical pain. So this is unrelenting night pain or constant pain that doesn't change with rest or positional changes. We're looking for this primarily because if an individual has night pain that's unrelenting, it can indicate that there may be cancer or tumor involved, just because of the fact that pain is typically worse at night in these individuals, because the body's stress hormone cortisol is the lowest, and that's our anti-inflammatory hormone, and when it's lowest at nighttime, that's generally when that pain tends to get worse versus throughout the day. And it could also be worse at night because we're more focused on the pain versus throughout the day we're busy doing other things, and again our stress hormone cortisol is more active throughout the day. So those are the 5 symptoms and questions that we're asking for during our subjective history to rule out some of these red flags, because of course if there is a red flag finding or red flag suspicion, this warrants urgent or emergent medical attention depending on what we think is going on. Obviously, if somebody has already had an MRI or imaging, then we would have a better idea, but until then that would guide us with regards to whether or not we need to order further imaging or blood tests or workup to figure out what's causing some of this pain if it doesn't really fall into that normal category of symptoms. And especially if the individual has been having this pain and it has been progressing, getting worse, we need to be mindful of it. So hopefully you found value in this video. If you did find value, please consider subscribing and liking this video and looking at some of my other videos for more content. But until then, we'll see you in the next video. Thanks for watching.